Hello, everybody. Thank you so much for tuning into the second Heading Home Educational Cafe. My name is Jody Jepson. I am the Outreach Director here at Heading Home. For those of you who don't know me, I do stutter. And this is...
I'm Carol Bruska, and I'm the Clinical Director of ABQ StreetConnect, and we're so happy to be here today.
Yeah, and we're going to be discussing ABQ StreetConnect, the program and the model. We've been working on this for 3 years, and we are going to highlight the latest outcomes, and which is in our report. And this can be found on our Heading Home website at headinghome.org. If you have any types of questions during the presentation, please submit them to us in the chat, and we will be answering those at the end of our presentation. All right. So who does ABQ StreetConnect serve? So we serve individuals who experience chronic homelessness with mental health issues and substance abuse and physical and medical different types of conditions. Obviously, these range from different type of infectious diseases, heart disease and diabetes, and different traumatic brain injuries. Carol?
And what we've discovered is many, if not most, of these are high utilizers of the criminal justice system, of emergency medical systems, of emergency departments and emergency psychiatric departments, as well as the MDC. And just as concerning as the fact that these are high utilizers of services is the fact that most have rarely, if ever, gone to see a doctor or a psychiatrist to deal with their conditions. What I'd like to do is start out with a quote from Sergeant Pete Silva, who is a partner, as APD is a partner in our services. And this is a quote that he had about our client that we're going to use today as our story to walk us through. Now, I do want to let you know that when we're talking about this woman, Edwina, we have been given permission by her guardian and by Edwina to discuss her story. So we just want to make sure that that was clear from the beginning. So this is what Sergeant Silva said. He said, one of the real success stories has been Edwina, an older woman addicted to narcotics. Because of her age, there's a lot more to worry about if we got into a force encounter with her. But she would do violent things, throw rocks, spit at people, argue with people. We've had to charge her with battery on a police officer. It didn't matter if we arrested her or if we cut her a citation. Law enforcement wasn't working. We're just waiting for that moment when things go really wrong. For example, she pulls a weapon on me. It could get really dangerous. So today we'd like to share Edwina's story with you.
Yeah, so Miss Edwina here, this was, her last arrest was in October of 2018. Prior to that arrest from 2016 to 18, she had over 31 different types of arrests. And then regarding her psychiatric and hospital admissions, she ranged from 75 to 85. So this really was a critical time in her life for an intervention, and we're just really blessed that with the partnership with the police department that we were able to start engaging Miss Edwina here to work on giving her some hope.
So this picture here is the story of Edwina at her last booking. And the picture on the left-hand side over there is Edwina today. What we'd like to do as a way to explain ABQ StreetConnect is walk you through the process of how Edwina got from where she was to where she is now. So one of the first things that we did when APD recommended that we go out to meet Edwina is we went out to try to engage her. Typically, we engage an individual by walking up to them, asking them what they need, how we can assist them, if we can give them food, water, a motel room. Like is typical with many of our folks that we're working with, Edwina was very, very hesitant at first. Oftentimes we would meet her and she would be high on meth and was agitated and did not want to engage. Other times she would engage but wouldn't allow us to get her into a motel room. Throughout this process, we had the support of APD and of Block by Block here in the downtown area to let us know where she was found, where they'd seen her last, and what we needed to expect when we went to visit with her. After about 6 months, we were able to get Edwina into a motel room. For us, this is always a great accomplishment because it feels like we're making the first step towards someone's journey to a positive place to stay. So we were able to get Edwina into a motel room, and that's where our navigators kicked in and started working with Edwina very intensely. So how that process works is the navigator walks with the client wherever they need to go. So in Edwina's case, they walked with her to get her Social Security card. They walked with her when she met with our Social Security Outreach, Access, and Recovery partner, Teddy Rivera, to start the SOAR process so she would have finances to cover her permanent housing. They walked with her when she agreed to get medication and see our psychiatrist, Dr. Abrams. They walked with her when she went from one boarding home to another boarding home. They walked with her to get food stamps and whatever other resources that she needed. They stuck by her side when she ended up on the streets again, when she would stop engaging, when she would come to the office high. We continued to walk with her as we do with all of our clients because we don't believe in giving up. So after several months of working with Edwina, we were able to finally get her to a place in her current group home after 3 or 4 tries. Now she has her finances on board. She has a place to live. She has acquaintances in her group home. She has 3 warm meals a day. She's reconnected with her aunt. She has everything in place that she told us that she wanted from the very beginning. She is still, although she's permanently housed, she is still a part of our family of StreetConnect.
Yeah, and I just want to add too, so there, we're really referring to a subpopulation of individuals who are homeless in our community, and Edwina actually was one of our pilot at our pilot phase stage. And so what we've learned over time is that there's definitely a subpopulation of folks who lack different levels of capacity to navigate the resources, and that's due to different levels of trauma. 90% of the individuals who are living on the streets experience some form of trauma, which is abuse, rape, and Miss Edwina here would self-report. That's what she experienced quite often. And so you talk about building trust, and that's really the core piece of our foundation as well. Is it takes time, and through that trust, we were really able to be a support for her and to give her hope, and to get her where she's at now.
And one of the things, the obstacles that we came across during the process was that as Edwina was no longer using substances and she was clear due to her medication, it became obvious that she was not able to make decisions competently for herself. So initially, we were able to get her a treatment guardian, which is someone who will help her make decisions about her psychiatric medications, which is crucial for many of our folks because without that support in place, they might not have capacity to understand the need for medication and the ability to make sure that they follow up with appointments. After a while, we realized that due to the nature of all of her previous experiences, whether it was the substance abuse, traumatic brain injury, or her mental illness, she was not able to make any decisions for herself. So what we know is that impairments in executive functioning often render such individuals limited in capacity to make appropriate decisions for their own health and well-being. And due to this, we reached out to the New Mexico Guardianship Office to apply for guardianship. And due to the support from Honor Guardian, we were able to get Edwina a guardian who then could help her make those decisions and make sure that she remained in an environment that was safe and healthy for her.
Yeah, and I just want to add to that too. So, these are individuals in our community that we're really not able to give a referral to. It's very clear. They're not able to access, basic self-care needs like going to get medical care or to really manage their just daily living skills. And so this continued to be really apparent when we, during our first, our pilot and our first year of operations, that there's definitely a group of folks who unfortunately, due to all of the challenges and barriers that we've shared in Edwina's story, is pretty common throughout the population that we serve. And these folks don't have a voice. And so it was critical, it is, as a community, that we dedicate and allocate resources to a subpopulation that really has no other option for hope and to have a quality of life and to have a safe place.
So what we also realized during this process is once we got Edwina her SSI, so she was getting a monthly check and now she was able to pay for housing and her needs, that she also needed food stamps and she also needed to have someone monitor her money. So we were able to work with Bridge to Success, and now she has a payee as well. So what some people might think in terms of restricting her ability to manage things for her, she actually is managing things for herself in much better way than she would have otherwise, because she's got those supports in place. The reason that we do things the way that we do is because our foundation is based on evidence-based practices. These include trauma-informed care, which means that we understand that most everyone has experienced some type of trauma, more or less than others. Most of the time when someone is experiencing homelessness, they have a 90% chance of experiencing trauma throughout their life. So this is going to impact their ability to navigate through the system, even with our supports. So if someone, for instance, is hesitant to go to the Social Security office, it might be because being around loud crowds is very stressful for them, and they need a level of care or assistance that will help them to make sure that they are going to the Social Security office in an environment where it's not as loud and it's not as stressful. Another thing that we do is we use the housing first model, and the housing first model is the belief that it's most important to house someone and then allow them to try, if they so choose, to stop using drugs and alcohol. So drugs and alcohol are never a barrier for them to become housed. And that goes hand in hand with that is the harm reduction model. Harm reduction model means that we give people the opportunity to use whatever substances they're using in the minimal amount of way in the safest environment. So we will support people in doing what they are going to do, but we encourage them to do that in a safe way so that it does not increase their risks. And lastly, like I spoke about previously, we use SSI, SSDI, outreach, access, and recovery. And that's the SOAR model that is quick access for people to be able to get Social Security. Typically, getting Social Security can take several months, if not several years. Through the SOAR program, that will be expedited. So within 3 to 6 months, individuals can have their funds on hand.
Sorry, Carol, I just thought it was really important to add about SOAR. So we're, and we're going to talk about our partners here in a second, but what's really a critical piece in our contracts, and I'm going to talk about that. So we have a contract through the city of Albuquerque. So we serve 30 individuals per year. And then in January, we received a contract with the University of New Mexico Hospital, which has just been a great learning curve and a partnership. But about that SOAR, so we've integrated that SOAR model into our contracts. Since we've been, our clients that we work with, 100% across the board have some form of benefits, SSI or SSDI. And really this is just a huge pathway that supports in their pathway to stabilization. It's just a huge piece. So I just want to thank Miss Rivera for her dedication and work with our team and the people that we serve.
And as such, she is a wonderful partner. We have, like we spoke about previously, we have Dr. Abrams, the psychiatrist at Presbyterian. And I've got a quote here actually that I'd like to read from her. She says, having an ABQ StreetConnect navigator who can find Jay and bring him in to get his injection for schizophrenia on time is critical. In the ABQ StreetConnect model, the team brings in 6 to 8 people and I dedicate a half a day to them. It's a really efficient way to deliver services to a high need population. So this is from our psychiatrist that we partner with, Dr. Abrams at Presbyterian Hospital.
And the most amazing opportunity about that is that she actually sets a half day every Friday for our Street Connect folks. And if for anybody that is needing any form of psychiatric care, you're looking easy at a 3 to 6 month wait list. And the reality is for the subpopulation that we serve, we can expedite this, fast track them into psychiatric care. It doesn't mean that they're going to choose at that time to get on some form of psychotropic medication. It just means that that they're willing and to at least have a relationship with Dr. Abrams to start that process. So it really has been a huge component to our success and to the folks that we serve.
And Edwina really is a perfect example of someone who has used every single one of our partners and every single one of the skills the Navigator has. So she went from living on the streets, addicted to meth, not having any supports in place, to getting Social Security, having a psychiatrist that she can see on a regular basis, getting all of her documentation that's necessary for her to move into housing, finding housing, getting food stamps, having a payee, having a guardian who can support her to make sure that she's doing well and is safe. She has, again, she's connected with her family again. She's got friends that she looks out for in her boarding home. She still connects with us, and she's a joy to be around, where as Sergeant Silva said in the beginning, she was very violent. So we haven't seen that in a long time period. So what we think of as a huge success is her going from an individual who was living on the streets to now the happy woman that you see on the other side. We're very proud of her hard work, and we're proud of all the partners that we get to work with, because without them, particularly without APD, we could not do the work that we do. So if nothing else, we'd like to say how much we appreciate the support that we get from the community and from the community at large, and from people like such as yourself.
Yeah, and I mean, there's due to the challenges that our folks have, whether it's medical or behavioral health, you know, sometimes their behaviors are so erratic that they're not able to access different types of services, especially for the community who serves individuals who are homeless. So, and that's not a bad thing. It's just really looking at the gaps and barriers in our community, that there's people out there who are suffering and having a really difficult time, and it's meeting them where they're at and not giving up on them, and walking them through the process. You know, one of our great partners is Albuquerque Healthcare for the homeless, and what's been a key piece about that is their medical outreach team. And so they're able to come out and do wound care and just so what that does, it builds that relationship with that doctor and the individual, but it also it decreases the utilization at the emergency room if they don't have to go there for care. So it's really thinking outside the box and what types of services and pathways that we can integrate for a population that really hasn't been served.
And yeah, without those partnerships, we certainly couldn't do it. So I have a question for you, Jody.
Uh-oh.
Tell me, what is it that gets you to come to work every morning?
Oh, geez. I definitely don't feel like this is a job, first and foremost. I'm so blessed. You know, when and as an executive of part of the organization, I have a lot of admin work, but I would way rather be out in the field. And I'm out in the field quite a bit with my team. And it really is getting to listen and walk alongside somebody who really has given up hope. Imagine in the system, you know, we could go on with stories, but one person was at the emergency department 4 times in a day. And I actually had walked with him through each of those engagements at the emergency room. And Carol can say at the end of the day, I wasn't sure I was gonna make it. I was in tears and frustrated and heartbroken. And that just even drove me more to really look at the system as a whole and creating systemic change. And it goes back to our partners in the hospitals and the city, and just creating a service model where we walk with people throughout wherever their path goes to get them to a safe place. I know that was big, but what about you, Carol?
I just love the work. I love being able to support not only the individuals that we work with, but our team as well. So one of the things is that it takes a very special type of person to do the navigation work, because it's not easy work. I can't say enough about our navigators. They are willing to try and try again and work as hard as they can. They come in early, they leave late, they bend over backwards to make sure that our individuals have food when they're in a motel. They make sure that they get to their appointments on time. They make sure that if there's paperwork that needs to be signed, they're out there getting that paperwork signed. And if the person is resistant, then they'll ask them again the next day and the next day. So for me, it's just being in this group of individuals who are so passionate about helping those who need the support. So that's what gets me up. I'm looking forward to coming to work every day, because I know that we're making a difference. And when we have examples like Edwina, where we know that she was on the brink of possibly dying on the streets, and now she's placed in a wonderful boarding home where she's got supports and friends and family connected to her, it's all worth it. It doesn't matter if some days we feel like crying, some days we feel scared, some days we are just exhausted and we can't wait for the end of the day. Every day we come back excited and ready to go for the next day, because we love what we're doing.
Yeah, and I just want to get a big, since we have the opportunity now, just to give a shout out to our navigators. They've placed, last week they placed 2 folks, and this week they've placed 3. So, I mean, that in itself is just absolutely amazing. And it really is the willingness of the individual. And why? It's because of the relationships that we build. We build the trust. We walk with them. It's just a blessing. So
thankful that we're here. And thank you. We're all excited that you actually want to hear our story, because one thing that Jody and I can't do is stop talking about what we do. We're constantly bragging about our program and our supports and our partners, because obviously we can't do this kind of work by ourselves. So without the support of everybody else in the community. And the thing that I find interesting is that in the downtown area, where most of our folks come from, we will have shop owners or restaurant owners come up and say, have you seen so-and-so? And we'll say, yeah, we know where they are. They're housed now. And they're shocked and surprised and excited and glad that that person is no longer on the street. So again, we're just thankful for what we get to do every day.
Yeah. So every year we feel it's really important. We are data driven. And so we're not going to continue to do our work unless we know that we have an impact through our data. And so we're really excited to come out with this year's annual report. And what's exciting about this report is we are continuing to see a decrease in the utilizations of emergency responders in hospitals. If we can continue and make an impact, and more importantly, I think, is to continue to have success stories like Edwina. I just can't say enough about, dedicating and allocating resources to serve the subpopulation of individuals who are experiencing homelessness. So we hope that you get a look at our report. We'd love some feedback. If you have any types of questions, we are learning every day. So take a look at it.
So I do have just a couple questions for you guys from the Zoom chat. The first one is, are there any items that people can donate that you need more than anything else? Or what kind of donations? And then.
Thank you. So yeah, so we're always in need of donations. The biggest one that we find are shoes, large, like size 10 and up for men, and 6 to 8 for the women. Shoes are just a big need. Also, Sweats are a big thing for us. Our folks, unfortunately, the clothes that they have on usually have been worn for quite a while. So sweats are great. They're easy. So socks are always good. Water.
As it's coming into winter time, for those individuals that we aren't ready to engage, we can always use some sleeping bags, because those are something that, while they're still on the streets and not ready to engage with us yet, at least we can give them something that can keep them warm at night.
All right, great question. If anybody has any more in the chat, let's keep them coming. The next question we have is, how does your partnership with APD work? Could you kind of describe that a little bit more?
Yeah, absolutely. So prior to coming over to heading home, I used to work for the Coast Unit, the Crisis Outreach and Support Team Unit with Albuquerque Police Department. There, it was just an amazing opportunity to work side by side with law enforcement. I just met the most amazing men and women who are doing amazing work every day. So that just kind of was a natural flow over for StreetConnect, because they really are the ones, our APD folks are on the streets every day. They're the ones who get calls for service. And so it's just natural that that partnership could be formed. We've got the support specifically right now from the downtown officers. So we meet every week, every Monday. We strategize our folks for that week who are the highest priority. And we talk about different engagements, how we can get their support, how they get our support. In our report, you'll see an interview with Sergeant Pete Silva, and he really talks about the work that we've been able to accomplish with them. We could not do our work, and we could not have the outcomes without the support of the Albuquerque Police Department.
And one of the things around that I would like to say is that how we work together as a team is that if they're coming across someone on a regular basis who has a mental illness and who is experiencing homelessness, instead of having to go out and engage that person every day, from a law enforcement standpoint, they can call us, and then we can engage and start that process, so they can be more appropriately sent to calls where their level of intervention is necessary, and we can deal with the individuals who are needing our services. So it's a good partnership, because we can help distinguish which services are appropriate for us and which services are more appropriate for the law enforcement, and then partner together to make sure that those people get sent to the right situation.
And I was going to say a perfect example of our first year of operations. We had a gentleman who was downtown extremely, so he had a diagnosis of schizophrenia, some substance abuse, and we had placed him into his first group home, and he'd come back downtown, but then he'd ask for a ride back up to his group home at the end of the day. And so our law enforcement team downtown would take him to his group home practically every day for off and on for a good month. And so it just starts to build a trust. And it also, officers, our team from the downtown really, what we've heard is that they're part of the solution, and they're not doing the arrests or the citations, which really, really just makes a huge difference, I would assume, in their day.
And their morale.
In their morale. So, yeah.
So here's a question from the Facebook comments. How many navigators do you have? And then kind of in addition to that, how many clients do you serve?
Yep.
Hold on one second.
Yep. So through our contracts, I shared a little bit that through the city of Albuquerque, we that funds 2 navigators, myself and Carol. And then we also have our SOAR rep, Ms. Rivera. So that's the staffing in our contract. We serve 30 individuals per year. And the reason for that, and we have been asked why, and the reason for that is because the complexity of the individuals It's really, it takes a lot of time, and we really want to dedicate those efforts in providing quality and intensive supports instead of a large amount of people doing the minimal amount of work. Our function, our mission is to get them placed. And so we're able to do that with that small of a caseload. With the UNM contract, we have 2 navigators in that contract as well.
Alrighty, and then looks like the last question in chat here is, where can people find this report?
All right, so this report is going to be on our web. This report is going to be on our website actually here very shortly, I think. So go to headinghome.org, and this will be on our website. Great. Take a look at it, and thank you very much,
So
Ms. Carroll.
thank you for joining us for the second Heading Home Educational Cafe. If you want more information on our programs, please go to the website, headinghome.org. Don't miss the next cafe, which will be next month with Dorothy Otero, our housing program director. She'll be discussing her program and how to get people into permanent housing. So thank you so much for sitting with us. We'll see you again next time. Bye-bye.
Bye-bye.